Today, we're diving into a fascinating new report from the McKinsey Health Institute, and it makes this really powerful new case for brain health. The big idea here is that investing in our minds, well, it's not just about our personal well-being. It's actually crucial for our entire economic future.
So I want to start with a number. Just look at it, 267 million. Now, what if I told you that this number, it actually represents years of healthy life that we as a global community could literally get back by the year 2050? It's a staggering figure, right? And it is right at the heart of this new research. But what does it really mean?
Well, that 267 million figure stands for something called DALYs. That's short for Disability Adjusted Life Years. To put it simply, one DALY is 1 year of healthy life that's lost, either to sickness or disability. So when we talk about getting back 267 million DALYs, we're talking about something huge, restoring millions and millions of years of human potential and just living a good life.
And that gets us to the core problem this report is trying to solve. There's this crisis, a massive global burden that's really hiding in plain sight. And it's something that affects every single one of us, often in ways we don't even realize.
So, when this report says brain health, what are we actually talking about? Well, it's basically these three big interconnected areas. You've got mental disorders, think depression, anxiety. Then there are neurological conditions, things like Alzheimer's or epilepsy. And finally, substance use disorders. You put them all together, and they represent this enormous challenge to our global health.
Now, you should know, this report didn't just appear out of thin air. It's actually building on years and years of foundational research, work that has been pointing to this huge global burden of brain health conditions for a long time.
You can actually see a really clear progression in the research. Back in 2022, the big focus was just on establishing the massive scale of the problem. But now, with this new report, they're taking the next crucial step. They're connecting that health burden to the economic impact, and, this is the exciting part, giving us new tools to actually do something about it. Okay, this is where things get really, really interesting. The report's central idea is something they call the health and wealth payoff. The thinking is, tackling brain health isn't just a cost we have to bear. No, it's an investment that pays off in two major ways for all of society. So here's how that dual payoff works. On one side, when we take action, we get healthier communities, and people just feel better. Their well-being improves. On the other side, we get stronger economies because productivity goes up. And the key insight, the real game changer here, is that these two things are completely connected. You really can't have one without the other.
And that brings us right back to our big number, 267 million. But now it has some serious context. By scaling up interventions that we already know are cost-effective for things like prevention, treatment, and recovery, we could actually get back those 267 million years of healthy life. And this isn't just wishful thinking. It's a real, quantifiable outcome if we decide to take action.
Okay, so we get the problem, and we see the incredible payoff. But the big question is, how do we actually do it? This next part is all about that, how we move from just having insights to making a real-world impact. And it starts with a new toolkit for action. You see, a huge piece of this new report goes way beyond just analysis. It actually introduces these practical, interactive tools, like a new data dashboard, that are designed for leaders and policymakers to start using, like right now.
So how does this whole thing work? It's actually a pretty simple but really powerful three-step process. First, the tool helps leaders get a real grip on the specific brain health challenges in their own region. Second, it helps them pinpoint the most promising places to take action. And third, and this is so important, it lets them actually quantify the benefits, both in health saved and in economic value created. It makes the case for investing in this stuff crystal clear.
All right, let's pull all of this together and talk about what it really means. Let's talk about the case for a better future and what this research and these new tools really mean for all of us.
When you boil it all down, the mission here is to completely change the conversation. The goal is to get leaders to stop treating brain health like some niche issue and start seeing it for what it is, a core pillar of both public health and economic development. And the impact of making that mental shift is just profound. When you invest in brain health, you deliver high value across the board. You're boosting individual well-being, you're strengthening the health of the whole community, and you're driving economic growth, all at the same time. So at the end of the day, this is not just about numbers on a spreadsheet. The economic models, those dashboards, even that massive 267 million DALYs figure, they're all just tools. Tools that are pointed toward one single, powerful purpose:
transforming human lives and building a future that is healthier and more prosperous for everyone.
So here's the bottom line. We've seen the incredible scale of the problem, but we've also seen the incredible potential that comes from taking action. The research is in, the tools have been built. The question this report leaves us with is a really simple but powerful one. What happens next? And you know what? The answer to that is up to all of us.